Inflammation is the body's natural protective response to injury, infection, or other harmful stimuli. Its main purpose is to eliminate the cause of damage, remove dead cells, and begin the process of tissue repair. There are two main types of inflammation: acute inflammation and chronic inflammation. Acute inflammation has a rapid onset and a short duration. A common example is tonsillitis. The main cells involved are neutrophils, and the characteristic feature is edema. Chronic inflammation has a slow or late onset and lasts for a longer duration. A common example is tuberculosis, also known as TB. The main cells involved are macrophages and lymphocytes, and the characteristic feature is granuloma formation. Now, let us look at the 5 cardinal signs of inflammation. The first sign is redness, also called rubor, which occurs due to increased blood flow. The second sign is heat, also called calor, which results from increased circulation. The third sign is swelling, also called tumor, which is caused by the accumulation of fluid. The fourth sign is pain, also called dolor, which is caused by inflammatory chemical mediators and pressure on nerve endings. The fifth sign is loss of function, also called functiolasa, which occurs because of pain and swelling. The common causes of inflammation include infections caused by bacteria, viruses, or fungi, physical injuries such as cuts, burns, and trauma, chemical irritants, allergic reactions, autoimmune disorders, and foreign bodies such as splinters. Several important inflammatory mediators help produce the inflammatory response. These include histamine, prostaglandins, bradykinin, cytokines such as TNF-alpha, interleukin-1, and interleukin-6, leukotrienes, and complement proteins. The major cells involved in inflammation are neutrophils, which are the first responders in acute inflammation; macrophages, which perform phagocytosis and help in tissue repair; lymphocytes, which play an important role in chronic inflammation; mast cells, which release histamine; and eosinophils, which are mainly involved in allergic reactions and parasitic infections. In acute inflammation, the events are divided into 5 vascular events and 6 cellular events. 5 vascular events. The first vascular event is transient vasoconstriction. This is a brief constriction of blood vessels that lasts for only a few seconds. The second event is vasodilation. The arterioles and capillaries dilate due to the action of histamine and nitric oxide. This causes redness, known as rubor, and heat, known as calor. The third event is increased hydrostatic pressure. Vasodilation increases blood flow and hydrostatic pressure inside the blood vessels. This causes fluid to leak into the tissues, resulting in transudate edema. The fourth event is increased vascular permeability, which is the hallmark feature of inflammation. The endothelial cells contract, allowing plasma proteins and fluid to leak into the tissues. This produces exudate edema, leading to swelling, also known as tumor. The mechanisms responsible for increased capillary permeability include formation of endothelial gaps, direct endothelial injury, leukocyte-mediated endothelial cell injury, increased transcytosis, and leakage from newly formed blood vessels. The fifth vascular event is hemoconcentration and stasis. As plasma leaves the blood vessels, the blood becomes more concentrated and viscous. Blood flow slows down, allowing leukocytes to move toward the vessel wall. 6 cellular events. The first cellular event is margination. Leukocytes move from the center of the blood vessel toward the endothelial lining. The second event is rolling. Leukocytes roll along the endothelial surface through weak, selectin-mediated attachments. The third event is adhesion, also called pavementing. Leukocytes firmly adhere to the endothelium through integrins. The fourth event is diapedesis, also known as transmigration or emigration. Leukocytes squeeze through the endothelial junctions and enter the tissues. The fifth event is chemotaxis. Leukocytes migrate toward the site of injury by following chemical attractants. The sixth and final event is phagocytosis. Leukocytes engulf and destroy microorganisms, foreign particles, and dead tissue. Finally, here are 2 easy mnemonics